much, Mr. Speaker. I guess I want to start out by talking to the principle of the amendment that's in front of us. And what I really see encompassed in this is the public's frustration over the what they see as a lack of accountability. So the whole concept of a wait list, while it may be arbitrary, it might be even a false accounting, and I'm sure there's people that can argue that. It is something that the public can grasp, look at, compare, and make their own decision. And based on what has gone on in this province over the last couple of weeks, the reaction I'm getting from my constituents and from others, and I don't know why I get them from others, but I do, I think because I used to be the health critic and I'm still on people's Rolodex, they're really frustrated and bewildered at what is actually going on. What is the real status of stuff? Is it as bad as people say, or is that rhetoric? Is it, well, I mean, yes, the honourable member from North Hill, it is Nose Hill, see? It says no, but then someone on the other side of me is going to say yes. For the public who are sitting in the middle of all of this, they're just saying, what the heck is going on? And they don't trust us anymore, quite frankly, and they don't believe us. And they want a measurement by which they can decide whether they think the system is doing well or not. Because remember, most people are not in the healthcare system, and hope they never will be. I hope that on their behalf too. And you hear, I've just read through a stream of blog postings that roll on, and printed out it was, I don't know, 10 pages or something of people commenting on this. And there's mostly, I don't want to say ignorance because that sounds mean, a lack of information about how the system actually works. And occasionally there's a few people who kick in there and say, no, 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 they use a system called triage and here's how it works, and anybody that appears in the emergency room with, not breathing, bleeding, or not conscious, or chest pains, or then they're in. And then you hear from the people go, yes, that's what happened to me. I was in, I had great care, no problem. Car accidents, front of the line, you're in. But then there ends up being this whole long discussion about how intoxicated people who've been let out of the shelters at 8 o'clock in the morning come in to get a bed to sleep off their drunkenness, and somehow they're getting ahead of other people in the line, and you think, really? I find that very hard to believe, but people swear that it's happening. And this is the kind of discussion that's happening out there. So there's a lot of, well, in the theatre biz you call it rhubarb, because that's what the crowds do, because you don't actually want to hear what an extra is saying in the back. So they do the old peas and carrots, rhubarb, 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 and that kind of gives a mumble of dialogue that you can't actually catch hold of. And that's what people are experiencing when they look at our healthcare system and go, what is going on here?